Julie, I see you're here for follow-up on your high blood pressure.
Yes.
How are things going?
They're going okay. I'm not taking the meds that was prescribed to me, but that's because my high blood pressure is because of anxiety. So, I'm working on that.
Now, this is the first time I'm hearing about the anxiety thing.
Mm-hmm.
Did you call and talk with anybody about discontinuing the hypertensive medicine?
No.
Just did it on your own.
Yeah.
And what are you using for anxiety? You mentioned the anxiety.
Yeah, Xanax is helping me.
And how did you get the Xanax?
My great aunt Dorothy, who was in hospice, she had some left over, and she recently deceased. So, I'm using that for now.
I see. And you need a special prescription for it to get from the pharmacy. And if you use other people's narcotics, that's illegal. That's against the law.
Okay. So is that something that you could prescribe for me?
Well, I think the better avenue would be to see if you have anxiety and what else we can use for the anxiety, because maybe that wouldn't be our first choice of medication to go to. And with that, we need to address your hypertension also, because all that may be linked together. With that in mind, would you mind meeting with Kate, our clinical pharmacist? She's here on staff, and what she can do is go into more detail on your antihypertensive medicine, some of the side effects of stopping it abruptly, and some education with that, and she can tell you a little bit more about the Xanax, the benzodiazepines too, and that might give you a little better insight. Would you mind if I called her?
Yeah, sure.
Okay. Okay, Julie, this is Kate. She's our clinical pharmacist.
Nice to meet you, Julie.
I kind of filled her in on what was going on with you with the blood pressure and the anxiety, and you stopping the medication for the hypertension, and then you found your aunt's Xanax. So I'm going to leave you two together and discuss those things. Okay.
All right, thank you.
Thank you.
Thanks.
So I appreciate you taking the time to meet with me today. I know that there's a lot of people to see in a practice. It can be really busy. How long have you had high blood pressure?
Not that long, maybe like a year.
Okay. And in terms of kind of the steps that you've taken to treat it before taking the Xanax, tell me a little bit about what you've used before to treat it, or what kind of lifestyle things you might have done.
I tried some running for a while.
Okay.
I don't really do that anymore. I was taking the blood pressure medication for a little while.
Mm-hmm.
I can't say I adjusted my diet really.
Okay.
That was too hard for me.
Mm-hmm.
That's about it.
Now, when you say it's too hard for you, is it like a particular reason that it was hard?
I like comfort food.
Okay. And salt
Yeah.
tastes good.
Yes, it does. Yeah.
Okay. So one of the things that is really, important for managing blood pressure is because if your blood pressure is too high for a long period of time, it can lead to a lot of other kind of serious health problems. So you can have problems with having a stroke, having a heart attack. You can develop heart failure. You can run into kidney problems. So a lot of things that are, can be very serious.
Okay.
There. Is it something that you've heard about before?
I didn't know the problems in general. I just knew that high blood pressure was bad to have.
Okay.
Yeah.
And there. So kind of based on what Henry shared with me, we have kind of two areas to work on. One of them is to work on trying to get back on track with the high blood pressure on there. So again, trying to make sure that big picture we're keeping you, healthy and trying to prevent these things happening in the future. And then kind of the second part is trying to work on treating your anxiety so that, that will be well controlled. You'll be feeling better on there as well.
Yeah. I really like that.
Okay. Looking through your records, I saw that you were on lisinopril before for your high blood pressure. Did you have any side effects or problems with that?
Not really. I just felt like my high blood pressure was coming from my anxiety. Like it seemed to be like I would feel my heart pounding more when I had anxiety. So it didn't seem like it was helping enough.
Okay. Besides taking the Xanax, have you ever used anything else to treat your anxiety?
Other than food, no.
Okay, okay. So one of the big concerns with taking Xanax is it's a controlled substance, and again, taking other people's medication can be very dangerous. And one of the kind of main issues that we worry about with Xanax is we worry about patients getting really sleepy with it. And if you take a dose that's too high and you're really sleepy, some patients can actually have decreased respirations, and they can have trouble breathing, which is very serious.
Yeah.
There. Have you ever been told that before? Seems kind of like
I didn't
you're
know the
surprised.
breathing thing. I mean, I definitely have felt sleepy before on it. Yeah.
So, one of the things I want to touch base with Henry is see what our next steps are. And one of the great resources that we have in our practice is we have a counselor who works with us. So that may be one option, and kind of think of different ways that we can help manage your anxiety.
Okay.
All right. Thanks for the referral, Henry. I appreciate it. So we had a good talk about the kind of two prongs of it. One, the anxiety, and then also the high blood pressure. Talked a lot about, kind of what are the long-term consequences. She seemed open to restarting her blood pressure medication, but I think bigger picture with that, she probably would really benefit from having a referral for counseling.
Great. Did you mention that Alicia or?
I haven't mentioned it to Alicia. I mentioned it to the patient. The patient was agreeable.
Perfect. Thank you so much.
You're welcome.
Okay, Julie. This is Alicia. She's our therapist.
Hi.
Nice meeting you.
That Kate was telling you about. So Alicia knows a little bit about your high blood pressure, but more specifically the anxiety and when you're taking the Xanax. She's just going to talk to you a little bit just to make sure that everything's okay, make sure there's no other issues that we need to deal with.
Okay.
Okay?
Okay.
All right, thank you. I'll leave you guys alone.
Thank you, Henry. How's it going, Julie?
Not bad.
Not too bad. So you came for a follow-up appointment with Henry?
Yes.
Okay.
It was just for high blood pressure, and I wanted to talk about anxiety.
Okay. So tell me a little bit about your anxiety.
I get it all the time. I really can't predict it. Sometimes it just, my heart's beating so fast, and that's why I feel like that's what really my high blood pressure is. And, the Xanax really, like right now, if you can tell, I'm very calm, and that's because I took it, and I'm just like, it mellows me out.
Okay. So from my understanding, you stopped taking the blood pressure medication and started taking the Xanax?
Yes.
Okay. And where did you get the Xanax from?
My great aunt Dorothy, she was in hospice, and she's since passed. So.
Oh, okay.
Yeah.
I'm sorry to hear that.
Thank you.
Okay, so you've been taking her medication? Okay, and have you spoken to Henry about getting a prescription yourself?
I did. He didn't really respond. He referred me.
Okay. I say that about getting your own prescription because it can be a little dangerous with getting taking someone else's prescription.
Yeah.
So just to be mindful about that, and I wouldn't want you to get in any legal trouble of taking someone else's prescription that is deceased. Okay, so have you tried anything to regulate your anxiety at all on your own?
Nothing's really worked.
Okay.
I used to run, and that didn't work. It seemed to I really didn't like how it made me feel. I avoid situations, and the Xanax helps me not avoid those situations. So I stay home a lot.
Yeah. Okay. When did you start feeling anxiety or feeling anxious?
A long time ago. It's been building.
Okay. And before the Xanax, did you take anything?
No.
Okay. So you just, sounds like you've just been kind of dealing with it?
Mm-hmm.
Okay. Okay. Have you ever spoken to someone before? Have you ever been in any type of mental health, got an evaluation?
I'm afraid to, and I didn't want to be judged.
Okay. What do you mean?
I was afraid that people would be like, "Oh, just get over it. Just deal with it. It's all in your head."
Okay. Have you had that experience before?
Yeah.
Okay.
Yeah.
Okay. People telling you to get over it,
Mm-hmm.
kind of thing. And that's challenging. Would you be interested in getting a mental health evaluation and maybe starting some therapy sessions to support you with your coping skills? Or I'm sorry, not with your coping skills, with your anxiety?
Yeah, if it's gonna help. I
Okay.
mean, at this point,
Mm-hmm.
I'm gonna be doing whatever I can.
Okay.
So.
Okay. And the reason I say coping skills is because that's where I was going with it, is kind of developing a toolbox of coping skills to support you with your anxiety. So Julie, I brought with me some coping skills or coping skills lists to share with you, and maybe that can be helpful with when you feel anxious, some different things that you can engage in. Would you be interested in taking that?
Yeah. I'll
Okay.
take a look at it.
So just on here are some different breathing techniques, some meditations, and some different things that you can do. Coloring, journaling, music, hot baths, things like that. Just little simple things that you can do to support you.
Okay.
Okay? And did you say you would be interested in a mental health evaluation?
Yeah.
Okay. So what I'll do is I will set you up with a mental health evaluation, and we can do it right here at the clinic. And then if you're interested in engaging in mental health therapy treatment, you could either meet with myself or one of the other therapists here and continue to build on these coping skills and supporting you with your anxiety. And if medication management is something that Henry sees appropriate, then we definitely will go that route too.
Okay.
Sounds good?
Yeah.
Okay. So what I'll do is, if you don't mind, I will go ahead and give Henry a call and have him come back in here, and I'll just give him a recap of what we just discussed and your willingness and your interest to engage in mental health, and we'll get you set up.
Okay.
Okay? Calling Henry. Hey, Henry, can you come back down?
All right, then go
Thanks.
ahead and hang up the phone.
Hi, Julie. Hi,
Hi.
Alicia.
Hey, Henry.
How do things go?
Things are going well. So Julie and I had a conversation, and I shared with her a list of coping skills that I had with me, and she is interested in doing a mental health evaluation and possibly engaging in mental health treatment, along with some medication management that you see appropriate for her to support her with her anxiety and getting some relief from that.
That sounds great. So, just to recap what we're going to do, you're going to restart on your blood pressure medicine.
Okay.
I'm going to see you back for that in about a month. So I want you to take it. If you want to stop it or something happens and you want to stop it, then I need for you to call me about that
Alright.
medicine. And then you'll follow with Alicia. I'm not going to start you on any medicine for the anxiety yet. I want to see how things go with Alicia first.
Okay.
And we'll keep in contact. If she thinks things are not going according to plan, or you start to kind of degress a little bit, then we'll think about that. But I think that would be a good plan for you, and we'll see how things go with that.
Okay.
Great.
Quick question, Julie. Do you still have Xanax left over?
I do.
Okay. Would you be comfortable with disposing it or having it disposed of? I know with Henry saying he's not going to prescribe any medication for your anxiety right now, that can be a little stressful.
I'm not sure how I feel about that.
Okay. Okay.
I guess I don't have too much left, so I guess if you're saying that these coping skills, they might work. I guess I can give that a shot.
It's a start. It might take the edge off at first, but just being consistent with it
Yeah.
can start working.
Okay.
Okay.
I think it'll be safer for you if you just dispose of the medicine, because if you need it, then I'll give you a prescription for it. If
Okay.
you need it, so you don't have to worry about that piece of it. But for right now, I think it's better, like Alicia said, just get rid of it.
Okay.
Okay.
All right.
All right. Well, thank you.
Thank you.
Nice meeting you.
You too.